one of the mainstays of my practice are my patients, and I come to work every single day because of that relationship that I have with them. And my practice is primarily cervical spine, where I enjoy a large breadth of different pathologies and conditions. And my litmus test for how I practice as a doctor is I would never do a surgery or treat a patient in a way that I would not want my family member or myself treated. The first time I meet a patient, I'm really trying to get to know them, trying to figure out what they want and what they expect from that particular encounter, and really what bothers them the most. Oftentimes, and it's very, very variable. I mean, some patients want a better quality of life. Some patients just want to be out of the pain and get a better quality of life. Some patients want to be able to do what they used to be able to do. And my goal, honestly, is to personalize their care and really tailor it to what they want and what they expect. I try to give a very realistic expectation for the patient so they understand what can be achievable and what is not achievable. And I think once you have those conversations early on and set a bar of what's achievable and what's not achievable, I think patients really appreciate that. And it also allows them to reconcile a lot of their own expectations and understandings of what is and is not possible. In spine surgery nationally, there's a lot of variability in terms of how a specific patient is going to be treated. And what we've tried to do here at the Cleveland Clinic is to make sure that primary care, our medical spine doctors, our advanced practice providers, and the surgeons are all practicing on the same page and are all approaching a specific problem the same. The majority of patients with spine problems can be treated non-operatively, and I think that's important for a patient to understand. And at the Cleveland Clinic, we take this holistic approach, a multidisciplinary approach, so we really can dial in with pretty good accuracy who should and should not get surgery, and if they're not going to have surgery, what type of non-operative treatment would best suit that particular patient.